everybody, Vanessa here with Visalia Talks, your local talk show that brings you everything you need to know about what's going on right here in your community. Right now, I've got a special treat. I've got Dr. Hobbs with us from Synergy, Chiropractic, and Natural Health. Doctor, how are you?
I'm doing great.
Thank you. That's good. Thank you so much for coming into the office and for sharing with us. I'm excited for what you're going to teach.
Yeah, my pleasure.
Yeah. So Synergy is what?
So synergy is a word that means a combination of things is greater than those individually added up. So it's like 1 + 1 + 1 equals 111, not 3.
All right, here we go. I like it. Okay, 1 + 1 + 1, because it's a 1 and a 1 and a 1, that's 111. Yep. So you're not adding them together, you're just placing them together.
Right. So in a negative sense, it would be drugs and alcohol is worse than drugs or alcohol, right?
Yes.
Diet and exercise is better than diet or exercise. If you combine them together, you get a greater benefit. So that's what Synergy means. So we recognize in people's health that they can have structural, chemical, neurological things that may be contributing to their ill health and that also may be needed for the solution.
I am so blown away right now in this tiny 30 seconds. I love it. I'm excited for this. Okay, so it's not addition, it's a combination.
Right.
I love that. Okay, so now that we've got that out of the way, what can they come to you so you can do for them? What are they coming to get at your office?
Yeah, so people come from all sorts of conditions. So we look at every patient with those lenses. Is there a structural disorder? Is there a neurological deficiency? Is there a nutritional or biochemical deficiency or excess, a toxicity or deficiency? And then what do they need? What do they want? And what do they need to get what they want?
Okay. So explain to me, how does this 1 + 1 + 1 equals 111 come into that play as when they come in and they, they're coming in with any type of ailment?
Right.
Yeah.
So let's say, for example, migraines. Somebody comes in and they say, I've got these terrible headaches and they are debilitating. What can you do for me?
Yeah.
So I'll do an evaluation. So we'll scan their spine and nervous system. We'll, with this tool, as well as my hands, look for what we call subluxations, spinal joint dysfunction. And that's the kind of the classic chiropractic. Go, okay, do they need a spinal adjustment? And that actually usually works for most people. And so that's the one component. But then we go, okay, but there's also, we know multiple deficiencies are commonly a cause of migraines. So we'll look for nutritional deficiencies. And we may do that initially, or we may do that as a follow-up if we're not getting the results we want initially with the chiropractic. But then also we know mentally. So mental stress, is that going to cause headaches? Well, it does for many people. So that's a contributing factor. We don't address that very much in our office, but we recognize that it's a component.
Yeah, like when everything else isn't working, it's like, okay, your body's not working. Maybe it's your mentals.
Maybe the fact that you hate your job and you're stressed out all day long, this could be a contributing factor that we just can't overcome.
Absolutely.
So
yeah. Awesome. Okay, so what do we got here?
Yeah, so this is what we think of, most people think of when they think of chiropractic. It's the spine, it's the bones. You're a bone doctor, going to crack my back. So crack that's a dirty word. That's a chiropractic dirty word, right? So we don't crack anything, so we do spinal adjustments, which means we're more specific, put things where they belong.
Yes.
And so this is certainly where chiropractic still is, but it's not just a bone on a nerve. We used to talk about, it's a bone out of place, pressing on a nerve, that interferes with nerve communication. And that's kind of true, but this is magnetic.
Oh,
so
that's cool.
That's kind of true, but it's really usually not a bone physically pressing on a nerve. So it's a joint not working correctly, interfering with nerve feedback to the brain. And so chiropractic of the 21st century really is about the brain and nervous system.
Okay.
And we're coming to understand that a lot more. And we're understanding that the way they described it in 1895, which is when chiropractic began, it's really, they were right. They didn't understand it.
Right. But now there's so much more research and looking into a body than there was back then.
We can do brain scans now, see what's going on. Of course, we don't do that in our office, but yeah, it's pretty amazing.
Yeah, I love that. So what did you say, in the 19 what?
1895.
In 1895. Yep. So has it just been re-looked at barely, like recently?
Well, so we've just got a lot more research. There's brains, what's called neuroplasticity, right? That's a word that almost everybody has heard of now. When I was going through school 30 years ago, that was a word that was kind of kooky. It's like, we had some chiropractors who were doing neurology, the nervous system work, and they started using that word, and other professions were like, well, that's just another goofy chiropractic word. Well, now we know it's not. The brain can change itself, and that's what neuroplasticity means.
Oh, okay. So can rejuvenate itself in a way?
Yeah. And that can be negative or positive. Neuroplasticity, if you have a lot of negative feedback to the brain, then it can become a negative thing. And positive, we can rehabilitate the brain just like a muscle, or much like a muscle. Mm-hmm. It needs to be properly exercised and nourished.
Yeah. So what do we do to make sure that we're only feeding our brain good and positive, so that way it stays positive?
Yeah. So that involves structural, chemical, and neurological. So let's take, for example, work with kids with ADHD and autism, dyslexia, and so that's what we call a neurodevelopmental disorders, and then we help rehabilitate from that. And so we'll look at things down in the brain stem. This is where more what we call primitive functions occur, primitive reflexes. These are things that in children who are after they're 1 year old, these reflexes should be gone. Okay. For example, like a stroke on the cheek.
And then they want to,
Exactly, mm-hmm. Yeah. So that's called the rooting reflex, the grasp reflex. There's several others. And so we check for these. Are these now integrated into the nervous system? Can we not do that every time we're stroked? And usually it's not at that extreme. It may be just a little, little twitch. Mm. And so we'll check for these in children and adults, and we find them present, then they need to be resolved, integrated into the full neurological function, so they're not interfering with development of higher neurological functions.
Wow, because it all starts somewhere.
Yeah. But something simple as chiropractic adjustment. Now, every chiropractor, even if they don't have a neurology diplomat like I do, they're adjusting the brain. A massage therapist are adjusting the brain. Counselors are adjusting the brain. Everybody is actually working on the brain, whether they know it or not. Sometimes for the benefit, sometimes for the detriment. So when we do an adjustment, moving the spinal bone, then that restores motion, which allows the body to naturally activate those nerves. But there's also initial barrage, a lot of influx of nerve impulses right at that adjustment time to activate an area of the brain that maybe have diminished activity. So it's kind of like priming the pump.
Yes. I love this all. This is super interesting. So you're not just a chiropractor. You're a chiropractor, but you also studied neurological stuff?
Yes. So just like a medical doctor, you're like, okay, what kind of a medical doctor are you? It's like, I'm a regular medical doctor. It's like, well, are you a pediatrician, a neurologist? So, well, a lot of them don't go on to get specialties, and that's fine. And so same thing with chiropractors. So you start out with a doctor of chiropractic, and then you can get a specialty. And so I did that with neurology.
Nice.
So you think, okay, what does a medical neurologist do? Well, they use drugs and surgery and advice. And so as a chiropractor, I use neither drugs nor surgery.
Love it.
I do give advice, but what else do I do? Well, that comes back to this rehabilitating the brain. Is it properly exercised and nourished? Is there a deficiency of toxicity that's not allowing the brain to recover the way it should?
Let's exercise and nourish our brain.
Yep.
It's as simple as that.
Use it or lose it.
You use it or lose it. Yes. I love that. So are you teaching? Do you teach these exercises, or is just when your clients come in, there's different exercises for different people because of what their life is?
Yes. So yes and yes. So we teach something called spinal hygiene. Okay. It's like dental hygiene for your spine. How do you brush your spine every day?
How do you do that?
Yeah. So there's some basic movements that really help out with that. And just moving your body, any exercise really is helpful. Yeah. But since we know that movement of the spine activates the nerves, activates the brain, we want to keep that full range of motion so those nerves are maximally activated. The brain is maximally energized. Also sitting all day long, so that's not good. So I teach people about ergonomics in the office. And one of the biggest things about that is just don't sit for very long. Yeah. They may ask you, what's the perfect posture to sit in for 8 hours a day?
Don't do that. Yeah. Not.
Right.
Well, I love it. Cool. So you're not just a chiropractor. You're not just a doctor. You're a whole wellness teacher.
Right.
Yeah.
So I also have a certification in functional medicine.
Okay.
So what is that? Well, that's where we basically do lab tests. But again, we're not looking for pathology. We're looking for deficiency and dysfunction. So if you think of the whole healthcare system like this tabletop, and I tend to call it a medical system instead of a healthcare system.
Okay.
So in the center of it is the emergency room. And that's where they save people's lives with drugs and surgery every day. Right? So it's wonderful. You don't have to do anything. Just go there, present yourself. They fix you up and send you off all fixed up, sort of.
Yeah, I was going to say,
right?
Yeah.
So,
for the moment.
Yeah.
Yeah.
So when they look for infections, trauma, and disease.
Okay.
Right. And so, so everybody kind of we multiplied that system, and now that's what we have our medical system in America, and most around the world is, and what we call this Western medicine, is based on looking for infection, disease, and trauma.
Okay.
And if they don't find it, they'll look at the symptoms. All physicians go to school, whether they be chiropractic or medical, go to school and learn symptoms and signs and blood work, etc. You go, okay, what do these things point to? And so that's why you go to physicians like, okay, I've got these symptoms. I know some of them. Maybe you can do some more fancy testing, but I don't have the knowledge you do. So can you tell me what I've got and what I need to do? And so 97% approximately of the medical system looks at these and they say, how does this point to an infection, disease, or trauma? And if it doesn't, then they say you're fine.
Yeah.
Now that's my only criticism. Your local doctor, I think they intend well. I think they're loving, they're caring, they got in it for the right reason. Of course, there's exceptions everywhere, right?
You get in it for the right reasons, but then sometimes that goes away with
and I'm
the
just
rules
gonna,
you have to follow.
Yeah, and so I'm going to assume really they're all in there for the right, because there's everybody, chiropractors, wherever, we all get squished by different systems, right? So assuming the best, at least at the local level, then why do they say there's nothing wrong?
And I'm still feeling this way.
Right. Then it's because you have no infection, disease, or trauma. And that's all they're looking for. Yeah. So no amount of looking for disease is ever going to teach you how to get well. And so, and again, I have my limitations, right? Somebody comes in with a displaced fracture and they're bleeding. I'm like, oh, you don't need an adjustment. You're fine. Yeah. It's like, no, you're not fine. You just don't need what I have to offer. Yes. You need to go to somebody who does emergency medicine, infection, disease, and trauma. And so that's important for me to refer out. In fact, I'm legal obligation to refer out for those things. And so I think it would be a good obligation for medical doctors and the sort to refer out for wellness. Like, oh, you don't have an infection, disease, or trauma.
It should be a thing.
This is great news. You're going to live for a while. I know you're miserable. I know there's something wrong. It's just, it's not responsible for me to use drugs or surgery on what you've got. Right. So what happens often is they say, we'll just come back later. And eventually a disease.
Go visit your regular doctor.
Right. So eventually a disease or infection comes back. Oh, and this is now your regular doctor. This is our whole medical system. This is not emergency room anymore. So this is all.
Doctors are doing the same thing as emergency room.
This is 97% of the medical system, right? Infection, disease, and trauma. And they use a bunch of anti-things, antibiotics, anti-inflammatory, antipsychotic, right? Everything's anti, kind of suppress.
I just feel like that just takes away your sense of feeling the thing that's wrong. It's not fixing anything that's wrong. Yeah. It's just allowing your brain to not feel that it's in pain or whatever.
It's true. And again, I'm so glad I'm not in that realm, in that profession. They have to deal with stuff that is super challenging. They don't know what's going to walk through the door. They have to be ready for it all. So it's a hard job. But when they realize it's not an infection, disease, or trauma, then should be referred to a wellness doctor.
Yeah, absolutely. Absolutely. So we've got to make that a thing. Community. Yes. And doctors, come on. If you don't have the solution, somebody does. Right. Right? Yeah.
And sometimes I don't. And so I tell them, I've got hope for you still. I don't have all the answers, but I know there's an answer out there.
Absolutely. Absolutely. So what is the scan? What is the scan giving you?
All right. So this scanner, this is an Insight scanner. So we have 3 different tools we use. I brought one of them today. And so I will pull this up. And so it checks for surface electromyography.
Electromyography?
Right? Yes. So electrical muscle activity.
Okay.
All right.
So I love a chiropractor,
yes.
Dr. Hobbs. I've been seeing chiropractors since I was 18. So that's over 20 years now. I had a big fall. And so ever since then, I just always saw the chiropractor just because I love it.
Right.
And I love how it makes me feel. And so it's really great to see that there's a chiropractor here who is so much more than a chiropractor. I love the fact that you're teaching to feed and nourish your brain.
Right.
It's important. It's important. Mental health actually is a really big thing right now of people needing to take care of their mental health. So I feel like that is like a lot of, it would fix a lot of that.
Right.
Making sure that that your brain is nourished and taken care of well.
Okay, so we're going to start at T1, which is your first thoracic vertebra.
Okay, do I stand up?
Let's see, it's probably best
good with the...
if you sit.
Sit? Okay.
Yep. But let's move your chair right here.
Yep.
So you're facing sideways, or maybe a little bit that way. There we go.
We're good?
Okay. And then, I don't know if you can see any of that, but what on here we'll be seeing, you won't be able to look at it. But,
okay.
And so what we're going to see is we're going to see the electrical muscle activity in your spine. So these are receiving information. So what you'll feel is just cool sensation. So T1.
Get one camera on him and then one on the screen right here too.
All right, so T1 is right here. So we put the receiving electrodes here. And then we wait for the signal to get calm. We have a left and a right channel. So the left side is red and the blue is right. So they're coming down, and I'm going to have you look straight forward. And once we have a good signal, it's steady, then we pull the trigger. Okay. And now we're going to go unilateral. So C7 here. And so what we start to see is these colors showing up on the diagram. White is normal. Yellow is underactive. And the other colors are overactive.
How's it looking?
So your right side is not happy.
Not happy?
Not happy.
That's probably why I'm in pain all the time.
Yes.
Does this have anything to do with, like, you know, if I sit on the floor, it takes a while to get back up? And then all kinds of noises come out while I'm trying to get up.
You sound like an old lady.
I sound like an old lady.
Yeah, that's not good.
And everything's going out on my back. Can't even pick up my grandbaby without my back going out.
Well, I don't think you're old enough to have grandbabies.
Well, I am.
Well, you're doing pretty good then. All right, and then the last one, C1. C1 is the most important area of the spine.
Okay.
One of the most important areas of the body because it has such high density of receptors. And those receptors are nerve endings that feed back to the brain. There's some chiropractors who only adjust C1 because it is so impactful for the whole body function.
Oh, wow. So it usually just fixes the problem there.
Yeah. So when I adjust the whole spine, okay, we've completed it. So we'll say complete scan. And then what we're looking at here, okay, so this is one image showing there's an extra activity on one side. This shows your total symmetry is 60%. That should be 100.
Oh.
Your energy index 184. That should be about 100. So your neck is working super hard.
Okay.
So normal postures can be very fatiguing for you.
Okay.
Right? So you sit at the computer for 20 minutes, and you're like, oh, I'm already starting to feel it. Where somebody else may be able to go 30 minutes or an hour. All right, and this is the areas that we scanned. So like I said, white is normal. So you have one normal one. That's great.
I have one normal one, guys. I've got one normal part of me.
All right, and then these other ones are overactive and one underactive.
Okay.
And then C3 up here is very overactive, more so on the left than the right.
What does overactive or underactive mean?
Yeah, so again, we're looking at electrical muscle activity. So it's just working really hard. And we go, well, why is it working really hard? So this is just part of a full exam. The other exam parts that we do are thermography, which is checking the temperature along the spine. Temperature is controlled by blood flow.
Is there actually a temperature? Because sometimes I feel like right here is actually literally hot. Like I'm like, oh my gosh, my back is like on fire. Literally feels like warm, hot, like hot. Yeah. Not like to the feel, but like inside my back.
Okay, yeah.
Like feels like it's literally on fire sometimes.
Yeah. So well, you know, to exercise, you get warmer, and
everyone keeps telling me I need to exercise more, Dr. Hobbs.
That's not
literally, everyone keeps telling me I need to exercise more.
So that wasn't what I was going to say, at least not yet. But when the muscles are overworking, they are exercising.
Okay.
So your neck, we didn't scan the rest, but your neck is exercising.
Okay.
In a negative way.
It's like exercising because it's working too hard to do what it needs to do.
It's like you've got a weight in your hand and you're holding it out. It's like, well, I guess that's exercise, but you hold it out there for 5 minutes. You're like, well, now I'm just tired and painful.
Right.
So that's what's happening up here.
Okay.
So then I incorporate that also with what I feel and how the joints are moving. And then that's where I know where we need an adjustment. And then we can go back and scan later and see improvements gradually. These muscles that are underactive will start to come online, and the ones that are overactive will start to decrease.
They'll balance themselves out. Nice. Guys, you don't know what's going on in your body till you can see it right there. You need to come and get scanned. Yes.
All right, so that's good for that one.
So that's interesting. So that now I know why I feel the way that I feel. I guess we'll swap seats here. So that's very interesting. So with that scan being done, so now you know what they need. Now you know what they need, where they need the adjustments, and what they need to do to start feeling better.
Yeah, and so with most of that, we can do without a scan. So I know where somebody needs an adjustment even without the scan. Yeah. But this does give information I didn't have before. But the new thing especially is it gives patients information they didn't have before. Yeah. So now they can see what I feel. Mm-hmm. So that's
it's a difference on the patient's side too, when you can physically see, like for you to say, okay, I'm feeling it, and okay, you need an adjustment here and here and this, and we're like, okay, adjust it. But then you see it and it's like, oh,
right.
We take it differently. Yes. I feel like.
Yes. Mm-hmm. Yep.
Yeah. So you brought the whole spine here. Was there something that you wanted to show on that?
So again, we think of chiropractic, we can think of the spine and the bone, and you can think of this as a shell. So there's the brain up here, and then the spinal cord inside, and so that goes inside. There's a column or a hole inside, a channel, and then these nerves exit all the way along. Okay, great. So that's your standard chiropractic, but this is not just a shell. So what we know now, and in fact, I did my a project when I was in chiropractic college 30 years ago on the density of nerve receptors at different areas of the spine and the body, and the density of representation, basically meaning how much is there in a square unit area.
Okay.
And this is the highest area of the spine.
Wait, how much? What is there?
So how many nerve receptors?
How many nerve receptors?
So they're like little doorbells. You can think of them like doorbells or webcams, because they can see what's going on. Now, there's just a signal, so the brain has to do the interpretation.
So that's where, boom, and then it goes, and then it tells your brain what just happened. Like, hey, you just got cut or whatever. Exactly.
Okay. So these nerve receptors are around the spine and in the muscles. They're activated by gravity. So anytime we're alive, these are sending signals to the brain. It's energizing the brain, activating it. But also with movement or exercise, which some people do.
Some people do.
So that
I'm signed up for the gym. That doesn't count.
Well, it's a thought that counts, they say. All right. So we won't dwell on that too much. So it activates these nerve receptors like little webcams or doorbells. They send signals to the brain. We talked about that barrage of signals that comes from an adjustment, which is usually a quick movement, which then opens up the space, restores motion, and has an initial barrage of activity to the brain, helps to get that pump working, prime the pump. So we don't think of it just as a bone, just a static thing, but a living, it's almost like an Iron Man suit instead of a knight in armor suit.
Yes, so much going on in there.
Yeah.
So much going on in there. Absolutely. So, okay. Synergy, guys. It's all about the synergy.
That's
yes. Right. Holistic approach to things.
Yeah.
Yes. And what made you want to go that route of being more holistic, on the more holistic side?
So that started in 8th grade.
Wow. Oh, I love it. I love this.
So in 8th grade, I was with most junior high kids. I was not happy with my body.
Okay.
And I would complain about it to family. And one day I'm taking some food, which is my snack after school. And I lived up in the mountains in Colorado. It's about 20 miles out of town, 8,500 feet. And I was in a valley, mountains all around me. It was a beautiful place, wonderful. And I enjoyed watching TV more than I did going out and enjoying nature. This is not good.
Yeah.
So I did not like exercise. So I like TV.
Okay.
So So anyway, so I'm pulling my snack, which is cinnamon sugar toast and cheese toast, probably about 6 of them out of the oven. Mm-hmm. And my brother looks at me and he says, "No wonder you're fat." I'm like, "You did not just say that."
Yeah, but he did.
He did. And it was totally true. Yeah. So I was doing this to myself, and something just clicked in my brain. And I'm like, I need to make changes. Yeah. And so I started making changes. Mm-hmm. But living in the countryside in Colorado, I didn't have access to much. Mm-hmm. My brother got the running magazine, my other brother. And so I started reading through running magazine. Didn't like running, but I started reading through it, and I started applying all the recommendations that were in there. Okay. And then I realized that I wanted to help other people with this.
There you go. In eighth grade?
Yep.
Okay.
Yep.
Okay.
So just something clicked, yeah. And so, so the only people around were my parents, who were trying to be healthy in a unique way. They'd exercise and they diet, they try different things, kind of the yo-yo stuff. Mm-hmm. And I'm like, I have the answer for them. Well, I realized pretty early on that not everyone wants your help.
Especially when it comes to weight
right.
stuff.
Who wants your junior high kid telling you how to be healthy, right? Yeah. So I'm like, well, I guess this is what I need to do for a profession, because I need people coming to me who really want help.
Right, right.
And then I recognized at that point the synergistic approach, even though I didn't know that word. I thought, if you do diet, that helps. If you do exercise, that helps. If you do them both, wow, that's really going to help.
Yes.
So at that point, we had structural and we had chemical. Yeah, physical and chemical. The neurological would come later.
Mm-hmm. Wow. So this is a natural born being here, wanting to help with your brain, wanting to help with your body, all since 8th grade.
Yeah.
Yeah. So I love it. I love that extra step that you took, went to go beyond chiropractic to neurological. Mm-hmm. It's something that's so different. I can't wait to go into your office and get a full, whether I need a scan or not, but let's get some extra let's get some brain exercise advice on how we can do that. But I'll work on the regular exercising too for now as well. I love this. So how can they get a hold of you?
So our website, visaliasynergy.com. That's a great place to go. Visalia, the name of the town. Synergy is that combination. Mm-hmm. I have Instagram. We post probably 5 posts on Instagram every week.
Love it.
4 or 5 posts. And then YouTube, we do some little longer format, and we do stuff on Facebook as well. So those are all good places. And then just call our office if you want help. That's a good way to go.
Yeah, and we'll have all the information on here. Any last minute or last words that you want to give out to the community before we let you go?
Yeah, so I have a mission.
Let's hear it.
So a mission is to restore hope and health for lifetime family and wellness for everybody in the community. Yes. And so that hope, that begins with information. Because if you know there's something you can be better, you know you're designed to be healthy, you know that there's something you can do about it, looking at physical, chemical, and mental, and then we're here to help.
Mm-hmm. Love it. Thank you so much for coming in.
Thank you.
Thank you for explaining all of this stuff. It's super exciting. The community is going to love it. And I want to check out your office and get some more going on this, take my chiropractic journey to the next level.
Absolutely.
Yes. Thank you so much, guys. Thanks for sticking around. Remember to shine your light.